Lisa Broyles with Way to Health MD, and this video is talking to you about your musculoskeletal system and how it relates to chronic inflammation. So my goal is to convince you that chronic inflammation absolutely affects your perception of pain, from back pain to joint pain, it doesn't matter. So there are two types typically of arthritis that cause pain, and I want to briefly discuss both how they're similar and how they're different. So there's rheumatoid pain, which is more autoimmune and more heavily influenced by genetics, but also affected by what you're eating, how you're exercising, how you're taking care of yourself, what infections you've had. And then you have osteoarthritis, which is typically less genetic, although there can be some component to the inflammation that your body kind of drives pushing osteoarthritis. However, usually osteoarthritis is more wear and tear, manual labor, the types of exercise you've done over your lifetime, as well as how you've taken care of yourself if you've eaten a lot of sugar. So everything does affect both diet, lifestyle, genetics. They're all involved in both osteoarthritis and rheumatoid arthritis, but I did want to make a distinction in the two kinds of inflammation that drive pain in the musculoskeletal system. So your brain senses pain through your pain receptors, which most people have heard of opiates for pain, such as hydrocodone, codeine, morphine, all of these. And the way they work is they hit a receptor in the brain that temporarily masks your perception of pain. The problem with these prescription narcotics is that when that medication wears off, when that hydrocodone or morphine wears off, you feel more pain than you would have if you weren't taking that medication, because they actually increase the pain signal, the perception of pain at the brain. They increase inflammatory cytokines like tumor necrosis factor and IL-6. So the terrible thing about opiates for pain is that they make you feel more pain when the drug isn't working. And this is why they're so addictive. Your body says, ouch, I hurt more as soon as my medicine wears off, so I better take more of it. And then you take more of it, and gradually that doesn't work, and you develop a tolerance, and people become addicted very easily to these substances. And eventually they no longer control pain, and your pain signals are so high that your body is screaming at you. And I'm sure some of the people listening to this have gotten to that point. So ideally, if at all possible, try to avoid taking opiate therapy as much. Been good studies on major surgeries, even like colon resections and joint replacements, that you can treat those. Tylenol and then initial morphine in the hospital, but transitioning quickly to ibuprofen and Tylenol for pain, the role of CBD oil for pain. Lots of studies showing that CBD oil, sublingual and topical, decreases the need for further opiates for pain. So I wanted to talk just a minute about CBD oil. The cool thing about it is that it decreases the pain signal. It does the exact opposite of the opiates. So whereas the opiates are making you feel more pain as soon as they wear off, your CBD oils actually decrease the perception of pain and decrease inflammation and decrease inflammatory cytokines. There's also another holistic treatment for chronic inflammation and chronic pain that I've used successfully in many of my patients, called low-dose naltrexone therapy, or LDN. You may have heard of naltrexone because it is used at a 50 milligram dose in Narcan. People that have overdosed, accidentally or intentionally, on an opiate, you can reverse that by giving them intranasal Narcan, okay? That's a 50 milligram dose. I'm talking about 4.5 milligrams, okay, a very low dose, but we have found that compounding low-dose naltrexone as an oral supplement actually decreases chronic pain and the perception of pain. So I have many people that are on low-dose naltrexone to manage their fibromyalgia or their chronic arthritis. Other strategies that I've found effective are reducing inflammation through your liver detox, which is decreasing your whole body inflammatory cytokines, therefore again reducing your brain's perception of pain. honestly, if you really want to do a good job with that liver cleanse, you should ideally do a session of colon hydrotherapy before and after your cleanse. I first found out about colon hydrotherapy from some of my older patients that were already more holistically minded that told me that they went and got a colon hydrotherapy session every 3 months because it helped their arthritis. And at first I was kind of stumped by this, but now that I understand that inflammation is a systemic whole body process, and that inflammation in your joints and tendonitis and bursitis, all of it is inflammation, it makes sense that if you can remove toxins and decrease inflammation, you're going to not hurt as much. So the colon hydrotherapy helps to wash toxins that are stuck to the colon lining and help your body eliminate toxins that are causing further inflammation. I did also want to mention that exercise with oxygen, called EWOT, or low-dose hyperbarics, called HBOT, are also effective at increasing tissue oxygenation, improving oxygen to the muscles. This often does help with muscular aching pain and people with chronic pain because you're helping the body kind of flush toxins with increasing oxygenation. So I have used that treatment effectively as well. I think the most important thing to remember is that inflammation affects every system of our body, and you can treat it naturally by keeping your diet low in sugar, by doing gentle strengthening types, stretching types of exercise. Swimming is a fantastic way to keep your joints moving and mobile without overloading them in pain. So, you may have a spine that's got a disc out or a bone spur, but the truth is it won't hurt as much if you can decrease that pain signal at the brain. Thank you very much.